All right, let's be honest. Things start off great in the bedroom. You're feeling confident, she's into it. And then, a few minutes in, your erection starts fading. Suddenly you're embarrassed, frustrated, maybe even hopeless. If that sounds familiar, stick with me. Because not only is this problem far more common than you think, it's also fixable. In fact, today I'm going to walk you through the 8 biggest reasons men lose their erections during sex, and most importantly, how to solve each one step by step. But before we dive in, let me quickly ask, where are you watching from? Drop it in the comments below. I love seeing the community grow worldwide. And if you want more evidence-based advice on men's health and performance, make sure to hit subscribe and tap that notification bell. Now, here's the first thing you need to hear. Losing your erection during sex does not mean you're broken. It doesn't mean you're less of a man. And it doesn't mean intimacy is over for you. The truth is, erections are complicated. They're not just about desire. They're the result of a delicate balance between your blood vessels, nerves, hormones, and even your state of mind. And if one piece of that puzzle slips, the whole structure can wobble. So instead of blaming yourself, let's understand the real reasons this happens and then fix them. If we haven't met before, I'm Dr. Jocelyn. I'm a board-certified urologist, and for the last 5 years, I've specialized in helping men protect their prostate, boost performance, and regain their confidence in the bedroom. And let me reassure you, I see men of all ages struggle with this exact issue. From guys in their 30s worried it's happening too soon, to men in their 60s who just want to stay strong for the woman they love. The good news? With the right approach, most men can see real improvement, sometimes in days, sometimes in weeks. So let's break this down. Here are the 8 most common reasons men lose their erection during sex, plus the practical fixes. Reason number 1, gravity is working against you. Most guys don't realize this, but the position you're in matters a lot. From a circulation perspective, if you're flat on your back and your partner is on top, gravity can actually pull blood away from the penis. And if you already have what we call venous leakage, where blood escapes too quickly from the erectile chambers, that problem gets worse. Biology. The veins in your penis are supposed to clamp down and trap blood. If they don't seal well, gravity helps pull that blood right back out. Emotionally, you might feel confused. Why am I losing firmness even though I'm turned on? Practically, change the angle. Positions like kneeling, standing, or having her lie down with you on top let gravity work for you instead of against you. Reason number 2, psychological stress and mental distraction. Your brain is the most important sexual organ you've got. If you're stuck in your head, am I doing this right? What if I lose it again? You activate your sympathetic nervous system. That's the fight or flight branch, the exact opposite of what your body needs for sex. Biology. Erections require the rest and digest system, called the parasympathetic. Stress hormones like adrenaline tighten blood vessels and shut the erection down. Emotionally, this is where embarrassment compounds itself. Once it happens, you're more likely to fear it happening again. Practically, try slowing down. Focus on your partner's breathing, her sounds, the feel of her body. Staying present in the moment is a powerful antidote to anxiety. Reason number 3, decreased penile sensitivity with age. As we get older, the nerve endings in the penis simply become less responsive. Add in diabetes, cardiovascular disease, or even years of friction, and sensitivity can drop by 30% or more by your 60s. Biology. Less nerve signaling means weaker arousal signals to the brain. Less feedback equals weaker erections. Emotionally, it can feel like you're doing all the right moves but not feeling much in return. Practically, devices that provide gentle vibration, testosterone optimization, and boosting nitric oxide levels can reawaken sensitivity over time. Reason number 4, insufficient arousal. Sometimes it's not that your body can't stay hard, it's that your mind isn't fully there. Biology. Without full arousal, your brain doesn't send strong enough signals through the pelvic nerves. Blood flow is weaker, and the erection softens. Emotionally, this often happens when there's stress in the relationship or distractions in the environment. Practically, don't rush. Spend more time in foreplay, tease, kiss, explore. If your partner is aroused and engaged, your own arousal deepens naturally. Reason number 5. Performance anxiety becomes a self-fulfilling prophecy. One bad experience can trigger a cycle. You worry about losing your erection, which activates stress hormones, which causes you to lose your erection. Biology. Adrenaline spikes, parasympathetic activity crashes, blood drains from the penis. Emotionally, each episode chips away at confidence, making intimacy feel more like a test than a pleasure. Practically reset the script. Focus on giving, not proving. Oral sex, sensual touch, massage. These take the pressure off and often bring erections back naturally. Reason number 6, cardiovascular and vascular health issues. Erections are a vascular event. They depend on healthy arteries and veins. High blood pressure, high cholesterol, diabetes, and smoking all damage the delicate lining of your blood vessels. In fact, ED is often the first sign of heart disease, showing up 3 to 5 years before a cardiac event. Biology, narrowed arteries mean weaker blood flow to the corpora cavernosa, the erectile chambers. Emotionally, it feels unfair. You want intimacy, but your body doesn't cooperate. Practically, this is a red flag to see your doctor. Improving heart health, exercise, diet, quitting smoking directly improves erections too. Reason number 7, hormonal imbalances, especially low testosterone. Testosterone fuels libido, penile sensitivity, and even nitric oxide production. After age 30, levels drop about 1% each year. Biology. Low T means weaker erections, less desire, and slower recovery between sessions. Emotionally, men often describe it as feeling flat, not just sexually, but in mood and energy too. Practically, get your testosterone checked. Sometimes lifestyle is enough. Sometimes medical treatment is needed, but you won't know until you measure. Reason number 8, lifestyle factors you overlook. Alcohol, poor sleep, dehydration, even a full bladder. These little details have a big impact. Biology, alcohol depresses your nervous system. A full bladder compresses pelvic nerves. Poor sleep throws off testosterone. Emotionally, these are the most frustrating cases because you could have avoided them. Practically, empty your bladder, hydrate, go easy on alcohol, and prioritize rest before sex. Simple fixes, big payoffs. Now that you understand the top 8 reasons, let's talk solutions. Here are the fastest, evidence-based fixes my patients use. Empty your bladder before intimacy. Use gravity-friendly positions. Extend foreplay for her and for you. Skip the alcohol, at least on nights you want your best performance. Space out ejaculations. Many men find 7 to 10 days keeps erections stronger. Use a constriction ring if venous leakage is an issue. Support your vascular health with supplements like citrulline, pomegranate, or French maritime pine bark extract. Address sensitivity through testosterone, vibration therapy, or circulation support. Small steps, big difference. Let me pause here and tell you something important. You are not alone. Millions of men, more than half over 40, experience erectile challenges. But here's the thing. When they take the right steps, most improve. Some dramatically. I've watched patients who thought intimacy was over rediscover passion, closeness, and confidence they hadn't felt in years. So if you've been carrying embarrassment, let it go. This isn't a life sentence. It's simply a health signal, and you can respond. Gentlemen, let me leave you with this. Age is not the end of vitality. Erections are not just about sex. They're about freedom, dignity, and connection. And every small change you make, whether it's walking more, cutting back on alcohol, taking care of your heart, or practicing presence, moves you closer to the confident, powerful man you want to be. So if this video helped you, give it a like so more men can find it, leave a comment below with the tip that resonated most, or share where you're watching.